Hey everyone, my name is James Forgrove. I'm originally from South Philadelphia. I went to Temple University School of Pharmacy, and some of my current areas of interest are solid organ transplant and ambulatory care.
Hi, I'm Caitlin Kennedy. I'm from Castle Rock, Colorado. I went to the University of Colorado School of Pharmacy, and my clinical interests are infectious disease and critical care.
Hello everyone, my name is Steven. I'm from Jackson, New Jersey. I went to school at Jefferson College of Pharmacy, and my clinical interests are in emergency medicine and critical care.
Hi everyone, my name is Lexi. I'm from Mountaintop, Pennsylvania, and I went to the Philadelphia College of Pharmacy for graduate school. My current clinical interests include critical care, emergency medicine, and toxicology.
Hi everyone, my name is Caitlin Gaynor and I'm this year's Temple University Hospital Genes Campus resident. And I'm from Berlin, New Jersey, so right across the bridge, and I just graduated from Philadelphia College of Pharmacy, and my interests include critical care and infectious diseases.
I'm currently on my abdominal organ transplant rotation with Adam Diamond, my preceptor. My daily activities include attending daily rounds, performing pre-transplant evaluations, making sure patients are receiving the right medications before and post-transplant. Something unique about this rotation that I enjoy is actually being able to see the patients from start to finish, so at the time of transplant, as well as following up with them in the outpatient clinic setting to making sure that they're receiving the right medications.
My current rotation is infectious disease consult service. My preceptor is Jason Gallagher. This is a really unique rotation that Temple offers. I get to round with the infectious disease team daily, and because of Temple's diverse patient population, I see a lot of complex infections.
My current rotation is in the medical respiratory ICU, and my preceptor is Christina Rose. My day usually just consists of working patients up in the morning, going to rounds with the medical team, and then in the afternoon it usually consists of following up with any questions, conducting topic discussions or journal clubs. And then something unique about my rotation is I have 3 APPE students working with me as well, so I also get to engage with them and not only improve on my clinical skills but also my mentoring skills.
My current rotation is on internal medicine and transitions of care, and my preceptor is Jamie Gregg. I currently round every day with the internal medicine teams and participate in multidisciplinary discussions. Some days I work in transitions of care and evaluate patients who are being transferred from the ICU to the floors. I really love this rotation because all of the patients are so diverse and no 2 patients are the same.
Hi, I'm currently on my bone marrow transplant rotation with Drs. Vallis and Coronia, and this rotation is really special because bone marrow transplant is such a special population that we don't learn about normally in pharmacy school, and as you can see, being on this beautiful campus doesn't hurt either. And some of my daily rotational activities include rounding with the bone marrow transplant team, as well as setting up chemotherapy and leading topic discussions.
As pharmacy residents, we're responsible for responding to emergencies throughout the hospital, such as code blues, rapid responses, and strokes in the emergency room. When we attend to code blue, we are in charge of manning the code card like one that you see here and administering medications to the patient throughout the emergency situation. For strokes, we go to the emergency room and work up the patient and mix and administer alteplase if indicated.
So at Temple University Hospital, we have 4 primary committees, which are pharmacy and therapeutics, formulary, infusion, as well as medication safety. Then we also have secondary committees, which are continuing education and recruitment. And this is a great opportunity for us as residents to build our leadership experience, as well as work with some of the multidisciplinary teams, which are nurses, physicians, as well as some of the clinical pharmacy specialists.
The residents rotate between clinical and staffing weekends. Specifically with the clinical weekends, the residents are responsible for following up on handoffs from the clinical specialists of services throughout the weekdays. In addition to this, we're also responsible for running programs like the investigational drug services, the ED culture callbacks, the antimicrobial stewardship day 1 reviews, as well as bug drug mismatches, and then finally the PEP to PrEP patient counseling.
So since I'm the Genes resident, I have a unique opportunity to staff here at Genes on the weekend, as opposed to the main campus residents who staff there on the weekend. My responsibilities on the weekend are covering the floors such as the emergency department, bone marrow transplant, intensive care unit, and the general medicine floors. Other pharmacy-driven protocols that we complete during the weekends are the warfarin protocol, heparin protocol, as well as TPNs.
The pharmacy residents have several opportunities opportunities for teaching experience throughout the year. So in the fall, we work with third-year AP students where we work with them really with medication reconciliation, anticoagulation counseling, as well as smoking cessation. And then in the spring, we work with the recitation class, and this is really where the students are applying knowledge that they were taught throughout the whole curriculum to a patient case.
Hi, my name is Joy Luong. I am the director of the PGY1 Pharmacy Residency Program, and I'm also the System Director of Clinical Pharmacy Services and Education at Temple Health. What I enjoy the most about being the director of the residency program is really seeing the goals that our residents have when they first start, and then helping them achieve those goals, which many of them do by the end of the residency year. It's my favorite thing to witness.
Hi, my name is Jamie Gray, and I'm the System Director of Medication Safety and Policy at TUHS. This is a new position here, and we hope to incorporate medication safety into the PGY1 residency program next year. Some things that might be include event reporting, RCA participation, review of ISMP best practices, and quality improvement initiatives across the health system. Additionally, I'll be serving as the PGY1 site coordinator for main campus and helping Joey with residency-related activities here. I'm super excited because as a previous PGY2 critical care RPD, my goal has been to get back involved with the PGY1 program in a leadership position.
Hello everyone, my name is Adam Diamond and I am one of our clinical pharmacy specialists in abdominal organ transplant here at Temple University Hospital. My role in the PGY1 residency program is to serve as a preceptor for the abdominal organ transplant rotation. This is an elective rotation that really challenges the resident to not only interact with transplant patients, caregivers, and their families, but also to manage them both in the acute and long-term phases of transplant. The resident's responsibilities on this rotation would be to round with the inpatient transplant surgery team while also peripherally following the transplant nephrology and transplant hepatology patients. There's responsibilities for medication management, dose adjustment, clinical care, discharge medication reconciliation, therapeutic recommendations for these patients during their inpatient stay, while also having the opportunity to follow along with transitions of care where you will see them and follow up with them in the ambulatory transplant clinic setting.
Hi, I'm Christina Regia-Check, and I'm a clinical pharmacy specialist that works with cardiovascular surgery and heart transplant. The rotation that I precept for the PGY1 residency program is cardiovascular surgery ICU. And the role and responsibilities of the resident on this rotation is to round with the multidisciplinary team, which is comprised of a pulmonary critical care attending, pulmonary fellow, nurse practitioners, and physician assistants, along with a surgical resident. And as you round with that team, your responsibilities are for the clinical care of patients who undergo various cardiovascular procedures such as CABG, valve replacement, LVAD implant, pulmonary thromboendarterectomy. In addition, we also have lung transplant patients and heart transplant patients along the way.
Hello everyone, my name is Sharif Badamosi and I'm the surgical trauma ICU pharmacist here at Temple University Hospital, and I'm also the preceptor for the surgical ICU rotation, which would constitute one of the required ICU rotations for incoming PGY1s. On my rotation, typically on any given day, I'll meet with the resident in the morning to pre-round, and then the resident would round on either the surgery or the anesthesia side, since we have two different rounding teams now in the surgical ICU. While on rotation and on site, the resident would also be responding to all codes and rapid responses that would happen on the floor. They would assist nurses with drug information questions and just really be there as a resource for the team in order to provide pharmacologic support for all of our very sick SICU patients. Some other activities that are typically done after rounds include topic discussions. I also have the resident do lectures for the surgical residents, and additionally put together a drug of the month flyer for nursing education as well. That's it.
Hi, my name is Laura, and I am the clinical specialist for the ICU at TUH Jeans campus. and I am also a preceptor for the Temple Pharmacy Residency program. Additionally, I am a preceptor for both APPE and IPPE pharmacy students. My time in my residency year at Temple was great. I learned a lot from my experiences, both in terms of clinical knowledge and professional development. I completed rotations at both TUH main campus and also TUH Jeans campus, so I gained experiences at both a large academic teaching hospital and a smaller community hospital. I've been at Jeans for several years now, and I've really enjoyed my time here. The prescribers at Temple overall are very accepting of pharmacy, and I feel that I've formed valuable relationships with other members of the multidisciplinary team. Overall, I think that Temple is a great place to work.
Hello, future residents. My name's Matt Baiocchi. I am a staff pharmacist at Temple University Hospital. I've been here for about 9 years and been working on the trauma med surg floor, which is up on the 9th floor, across from the surgical ICU. And I'm just going to give you a rundown of my responsibilities day to day. So usually we're in charge of order verification primarily. And on top of that, there's a couple pharmacy-driven protocols that we have, such as IV to PO, conversions. We also have the vancomycin monitoring program, anticoagulation monitoring program. So we pretty much, it's like a thorough chart review that we perform, and these programs help us, organize our review. On top of that, I serve as a drug information resource to the physicians while they're rounding. Although I don't round because there's several teams up here, so we wouldn't be able to round with all of them. I sit right here at the nurses station, and I'm available throughout my whole shift. Good luck, and I hope to see you at Temple next year.
Hello, my name is Craig Whitman. I'm a clinical professor of pharmacy at Temple University School of Pharmacy. I'm the associate chair of the Department of Pharmacy Practice, and I maintain a practice site where I precept students and residents in the medical respiratory ICU at Temple University Hospital. My favorite thing about the PGY1 program is being able to see all the residents grow from students who just graduated from pharmacy school into independent clinicians by the end of the year. That's my favorite thing.
Greeting from Philadelphia and Temple University Healthcare System. My name is Amir Imamifar. I'm the Vice President and Chief Pharmacy Officer for the healthcare system. Thank you for watching our short video of our Temple University Hospital preceptors and residents. We enjoyed making this video, and we hope you enjoyed it as much as we had fun making it.